Hospitals across the state only have a handful of open beds to care for the most critically ill children. This is a dashboard of the North Carolina Pediatric Society. It's using this to be able to track capacity in pediatric ICUs.
On average, they're 94% full as more children are getting sick with RSV and the flu. Only on WRAL, Matt Tallhelm takes us inside UNC Children's Hospital, where they're treating tiny patients who are struggling to breathe.
There are 20 beds here in the pediatric ICU at UNC. This room is available right now. It just became open, but there's already a patient on the way to fill this spot as a surge in respiratory viruses keeps this hospital at capacity.
The colorful cartoon characters painted on windows and walls provide camouflage from the urgency happening in these hallways.
Something significant is going on.
Doctors and nurses descend on a room in the pediatric ICU.
You have 2 attendings, a fellow, at least 1 respiratory therapist.
Where under mounds of medical tubes and tape, the tiniest patients battle for each breath.
The doors break open, they're all coming in just to make an assessment.
Dr. Joyner is chief of critical care medicine at UNC Children's Hospital. He gave us exclusive access to the PICU, where 40 to 50% of new patients right now are in respiratory failure.
For many kids, that come in, they're really struggling to breathe. They can't they have a weak cry, they can't even fully cry, just as we expect a child to. They're not able to do that.
UNC Children's started seeing a surge of 134 RSV cases in late September. It peaked so far at 205 by the end of October, before dropping to 161 cases last week. Now the hospital is seeing an influx of children with the flu, up from 24 cases just 3 weeks ago to 285 last week.
The biggest thing for us right now is the sheer volume.
You know those rooms by these purple signs posted on the doors. They warn anyone who enters to use droplet contact precautions to prevent spreading respiratory viruses. Inside, children are treated with oxygen masks or breathing tubes. The worst cases require a heart-lung bypass machine that pumps blood from a baby's body and circulates it back filled with oxygen.
It's slow. It's a slow progress. It's sometimes very slow to start to see recovery, so we see families getting exhausted.
Nurse Joy Hazard has seen the resilience of children as they recover from these viruses. It's why her team pushes through the staffing shortages, a pandemic, and now this new surge.
It is what we do. We are used to a busy unit, but these waves of viruses after viruses, we pull together. We have a great team. I mean, that's why we're still here.
Inside the pediatric ICU at UNC Chapel Hill, Matt Tallhelm, WRAL News.
Those babies and their families going through so much. Symptoms of RSV include a high fever, bad cough, runny nose, and difficulty breathing. Dr. Joyner says it's usually worst on the 4th and 5th days of infection, and most children will recover within 10 days.